everyone. My teaching project is going to be over patient experience, improving communication scores, and how hourly rounding can make an impact. Any patient who discharges home from the hospital receives a survey that's implemented by the CMS. This survey is called Hospital Consumer Assessment of Healthcare Providers and Systems, or other words, HCAHPS. The CMS uses the survey for public reporting as well as value-based purchasing. I've also provided a short video on reasons to choose CAHPS survey if you have an interest in watching at a later date. The public reporting has 3 goals that have shaped the HCAHPS survey. First, the survey is designed to produce comparable data on the patient's perspective on care that allows objective and meaningful comparisons between hospitals on the domains that are important to the customers. Second, reporting the results to the public is designed to create incentives for hospitals to improve their quality of care. And third, public reporting will serve to enhance public accountability in healthcare by increasing the transparency of the quality of the hospital care provided in return for the public investment. So basically, you want good scores so that people want to choose your hospital. The hospital value-based purchasing program rewards acute care hospitals with incentive payments for the quality of care, not just the quantity, provided in the inpatient hospital setting. The program is designed to make the quality of care better for hospital patients and hospital stays a better experience for the patient. So how do we improve the patient experience? In my organization, we focus on the scores, which are available to all staff on Power BI. It is on the intranet and available for anybody that would like to review it. And our initiatives are based off of the lowest scores reported that we can see in Power BI. Our organization has been struggling with nurse communication scores for years. The first initiative that I'm aware of that was implemented back in 2022, we moved from shift report at the nurse's station to bedside shift report. Education was provided initially, but staff was slow to be consistent with performing bedside shift report. We ended the fiscal year 22 at the 43rd percentile in nurse communication. In 2023, we had leaders completing audits every morning and night at shift change to hold teams accountable and to hardwire the bedside shift report process. Those efforts left the organization ending fiscal year 23 in the 51st percentile. So they had went from the 43rd percentile to the 51st percentile, but you can see on this graph that they were very inconsistent throughout the year. By the end of 2023, we had felt like the bedside shift report was hardwired with teams, but our communication scores were still not where we wanted them. So the end of 23, we initiated an hourly rounding expectation. We posted this flyer explaining the why, when it should be happening, some key words staff should be using, tips on engaging with the patient, and what to document. During this initiative, we put out a Sign Up Genius, and we had staff come in for a mandatory education session on what hourly rounding looks like. So that initiative didn't get us far either. We ended the fiscal year 24 in the 51st percentile, which is where we left off in fiscal year 23. And again, you can see not super consistent, more consistent in the beginning of the year, and then we really dropped off in September. So that brings us to 2025 hourly rounding, my hardwiring project. We have posted another flyer with goals of being in the 76th percentile in March, April, and May, 80th percentile for June, July, and August, and 85th percentile in September, October, and November. We had every employee scan the QR code, and they were expected to complete the quiz by a certain date, and managers held them accountable to getting those completed. These are just some examples of questions that we asked on the quiz. We had 9 total questions, and the 10th one being an acknowledgement. So this acknowledgement essentially says that if we don't meet our target goal of being in the 76th percentile in nurse communication for March, April, and May, the departments that don't hit that goal will have to revalidate everyone on hourly rounding. We also completed a competency checkoff with every employee, where leaders would go to the floor and observe each employee completing an hourly round, and provided immediate feedback or praise depending on how well they did. So we're currently in the 47th percentile for the fiscal year 25, but as you can tell, you can see that after February, there's been this steady increase in the score. So from March to current, the teams are in the 79th percentile. And if you remember, our goal was to be in the 76th percentile for March, April, and May. So far, the teams are doing great, and it's proving to be a success. So why is it important to hardwire this process? The purpose of rounding on patients every hour is to proactively address patients' needs. By doing so, we increase the quality of the patient's experience at our organization. So if it's done effectively and consistently, hourly rounding decreases call lights, decreases falls, decreases hospital-acquired pressure injury, and it improves the patient's perception of care. You may be asking how any of this impacts communication. AIDIT is a communication tool that's used widely by healthcare organizations. It helps providers engage patients in their care. It should be used in conjunction with hourly rounding. So when you go into the room, you should be acknowledging the patient, introduce yourself, what you're going to be doing and how long it is going to take, and then you thank the patient before you leave. By making your hourly rounding intentional and utilizing AIDIT during the hourly round, this can make a patient feel more involved in their care. It can make them feel more empowered and more likely to voice concerns. Although it doesn't necessarily mean that the quality of communication between a patient and a nurse improves. To ensure the quality of communication improves, it's important to have patient-centered communication. This involves active listening and not interrupting the patient. Be engaged with what the patient is saying. Maintain a positive and empathetic attitude. Don't use medical jargon, and be on the same page with the patient's goals for their stay. Thank you for your time, and please continue on to take a short quiz.